Okay, so if you don't consent to recording, we are going to ask that you please drop off the line. You can always follow up with me one-on-one. We'll be sure to get you connected with all of the presentation materials and any questions that you may have. We can also link you with Shannon to get those answered as well. So you won't miss out on anything. So once you get that approved, we can go ahead and get started. Once again, welcome to our Tribal Public Health. There we go. Our Tribal Accreditation Learning Community, also known as TALK. So this is kind of like our monthly meeting grounds where we discuss all topics related to public health improvement, systems improvement, anything along the lines of public health accreditation. So we get to hear about everyone's experiences and the great work that they are undertaking related to several of the topics that go along with that journey to public health accreditation. So we're so glad that you can join us for our talk this afternoon. My name is Jessica Dean. I am a program manager with the National Indian Health Board. I've been working in this capacity about 3.5 years now. So if you participated in any of our capacity building efforts, anything with accreditation, some of our ECR work, you've probably seen my face usually talking. So I'm glad to have you here. We're going to start out with a round of introductions, and I want to turn it over to Shannon so she can introduce herself as well. So Shannon, whenever you're ready.
Hello, everybody. I'm Shannon Lang. Thanks for having me today. I am currently the Director of Native Health and Wellness at NPHI. It's a nonprofit public health organization based in Michigan. I've been working with tribes and tribal organizations on a variety of health programs and doing mostly work with data, helping write proposals, do evaluation, and lots of capacity building related to community health assessment, improvement planning, and strategic planning. I think that's all for me. Pass it back to you, Jessica.
Awesome. Thank you so much. So yeah, Shannon was actually introducing me through one of the tribes that's had the privilege of working with her. So we're so glad that we can kind of close that loop and get her linked up with some of the other tribes who have great interest in community health assessment. So this is a really hot topic for us. So we're glad that we can link you guys with Shannon and the great information that she's going to share today. Okay, so let's do a round robin around the room. There aren't too many of you guys here with us right now, so we try to keep it a little bit intimate and personal so we can get to know you, learn about where you are in the process of completing your community health assessment. Join us by video. You can do that as well. We can start out. Everyone, feel free to hop in when you're comfortable. But Helen's here on camera, so Helen, if you would like to introduce yourself, it's good to see you again as well.
On mute. Hi, everyone. Sure. Jessica, thank you so much for sending that invite. I believe this is my first meeting like this with the talk. So it's great to be here. My colleague, I'm with the CDC, the Public Health Infrastructure Center. My colleague, Sharice Walcott, is out today, but I'm happy to be here to really listen and to see how this works. On this end, we work with Jessica on our 1802 partnership COAG. And yeah, so thank you so much, Jessica, for inviting us.
Yes, good to see you again. So our cooperative agreement with the CDC is actually how we fund our current Strong Systems, Stronger Communities project. Is where we provide funding, resources, trainings to tribes that are in the pursuit of public health accreditation or just any public health improvement projects overall. So we're really glad to see you on the call. Okay, let's circle over to Lindsay and then Feline.
Good afternoon, everybody. I was on, I guess, last month and talked a little bit about our NACCHO MAP pilot grant that we participated in, and These were also passed along to me by my accreditation specialist, Martha. She suggested that I start to join these. So here I am, and I'm excited to continue to share and learn with you all.
Good afternoon. I'm Feline Herrera and glad to be back and to join you all in this session. And I'm with Navajo Nation, Navajo Health Education Program under the Navajo Department of Health. And we started this initiative a while back, and the leader was Miss Antonez, who has left the Navajo Nation, and we got a robust group of young folks who are here to keep it moving. And I'm just like a historical person to shed some light and information to share with them. So happy to be here, and thank you for the invite, Jessica, and happy to participate. Thanks.
So glad to have you back. Okay, let's see. We have JC and Radiana. I'm sorry if I'm pronouncing it wrong. Please correct me. I know I've seen your name before, so I want to make sure I get it correct. But we can go with you guys next for introduction.
Hi, everybody. I'm sorry that I was a little bit late to the call. Can you hear me okay? Oh, maybe I can't hear you.
We can hear you.
Oh,
I
okay.
can hear you.
Okay, great. My name is JC Shepard. I am the Community Health Manager and Public Health Officer here at Forest County Potawatomi Community. Were we just giving a little kind of where we're at? Is that, or in as far as accreditation goes? Okay. I think I've joined a call in the past and just want to make sure myself or my staff are on. We are kind of in the thick of reaccreditation. So we're due for our application the end of this month. So just kind of trying to organize ourselves with all of that. But aside from a couple staff here, we are all brand new prior from our initial accreditation. So it's a big learning curve for most of us here, but appreciate the time to be here and visit with all.
Hello, everyone. My name is Radina Combe. I apologize. My camera is off. My laptop is plugged into my main PC, so I don't have camera access. I'm from the Navajo Epidemiology Center. I'm a senior program project specialist. I was invited to this meeting. The individual that I believe does the accreditation is currently not here, so I'll be taking notes for her. Her name is Cheryl Willie. And I do have my colleague, Cy Seminole Francisco on the call too.
Hi, everyone. Yeah, I apologize. Same situation with Radina. I don't have my camera phone or the camera showing me. But happy to be here. Just late notice with from Radina to attend the call. I understand the topic is about public health accreditation, and as a colleague to Radina and Cheryl, and also to Feline, who's also on the call. I am from the Navajo Epidemiology Center. I'm a project manager, and I am involved with several projects, but primarily the one that has a focus to this topic is a health survey that we've been conducting for a number of years now. And some of the information we're garnering from that health survey can be applied to identifying health indicators, which would help us to prioritize what health status looks like for Navajo Nation. But more meaningful is that I serve as a co-lead, and we're actually discussing community health assessments in the past few weeks. So myself and a colleague from our partnership we have with Navajo Area Indian Health Service, we're embarking on coming together as a group and discussing community health assessments. So just FYI, glad I could join this meeting. Thank you.
Thank you so much for joining us today. Okay, and Sheena, would you like to introduce yourself as well? I think that's the last one, but if I miss anyone after Sheena, please feel free to join in and introduce yourself as well.
Good afternoon, everyone. My name's Sheena Lambert. I'm the Public Health Director here for the Eastern Band of Cherokee Indians. This is actually my first time being on the call. Thank you, Lindsay, for extending that invitation. Lindsay's on the call as well. And we are actually in the process of being public health accredited, hopefully towards the end of that process. We've had a site visit and our virtual site visit as well. So closer to the end, hopefully, depending on the committee's determination. And in terms of our health assessment, we started updating our tribal health assessment in the fall of 23. And we did a lot of primary data collection, and we are working really hard on that secondary data collection right now, with our intent to have a publicized new, what we call thaw, in May of this year. So it's a heavy lift. It's a lot of work, as you all know, but we're excited to get it done and excited to see the results. So thank you.
Awesome. Thank you so much for joining us. And I see Dave came in. David Dolly, would you like to introduce yourself to everyone?
Hi, yes, I'm Dave Dolly. I'm the Director of the Health Department for the Wallapai Tribe.
Awesome. Okay, I think that's everyone. So we can go ahead and get started with our presentation today. Shannon, whenever you're ready, you can go ahead and begin.
Sounds good. Thanks everyone for being here. I'm going to reintroduce myself since we had folks join after I did my intro. So you're like, why is this person talking to me and what does she know about this topic? My name is Shannon Lang, and I am currently the Director of Native Health and Wellness at MPHI. It's a nonprofit public health agency based in Michigan, but we do work nationally. I've been working with tribes and tribal organizations since the early 2000s, so about 20 years, and all things related to public health, but have spent the last 15 doing quite a bit of work with tribes doing community health assessment, improvement planning, strategic planning, and capacity building for public health accreditation. So I'm going to share with you today sort of my perspective on doing tribal community health assessment in ways that people feel navigating a somewhat complicated and at times overwhelming heavy lift, as I heard some of the different ways you all described the process. So when Jessica asked me to present on this topic, I was a little overwhelmed in trying to plan for a short presentation on a huge topic with many different elements for an audience of people who are probably at really different stages and understanding what community health assessment is and how to do it. So I tried to think about what I could bring to the conversation that might be a little bit new or different. And so I thought about when I work with tribal health agencies, what they have told me was most helpful to them. And that's really what I'm going to focus in on. So my goal, my unwritten goal, is that I share with you some of the things that I have found most helpful in terms of models and tools. I'll share some examples from the work that I've done with Sioux Ste. Marie Tribe of Chippewa Indians, and I will hopefully simplify things in a way that may help if you are feeling overwhelmed with the abundance of standards and measures and frameworks that are out there. Just point to some more clear ways to just organize your thinking about what community health assessment is, and importantly, how some new ways that you may communicate what it is to community members who aren't sort of living and breathing all of these public health terms and concepts on a daily basis. So I'm going to share screen. I'm also going to ask for some grace from you if weird things happen, such as my children come running in or my dogs get let in, because 3 to 4 o'clock is when all of the excitement happens in my house. So I was a little hesitant to jump in on giving this presentation at this time, but we're just going to go for it, and I'm sure you all will give me some grace. I am going to do a slide share. And so when I do this, my whole screen is going to be taken up with my slides. So Jessica, if someone put something in the chat, if you don't mind prompting me, I'd be happy to answer questions throughout. I just won't see them unless you prompt me. Okay, so I titled this Empowering Tribal Community Health Assessments because what I have found is when folks are just getting started or when they are trying to navigate this journey, it can be from the very beginning a little intimidating or, as someone said, overwhelming because it is a heavy lift. But I'm hoping to give you new ways of thinking about it that help you build courage and confidence no matter where you're at in the process. And so my written goal for this is to describe what I see as essential components of a robust community health assessment that covers the essential elements also that FAB describes in the standards and measures. So really focusing on engaging community, using best practices and models, and importantly, promoting sovereignty, using technology where you can to strengthen capacity and foster confidence to do systems improvement. So I'm sure you're familiar with the definition, but just to make sure everybody is, I'm working with the definition that community health assessment is a process that identifies key health needs and issues through systematic, comprehensive data collection and analysis. And so you will often see definitions of community health assessment that focus on how you should have ownership amongst community members at all phases, have diverse community engagement. Importantly, that you define the community that you are assessing, that you practice transparency and accountability in your process and with the data, that there's a focus on continuous learning and improvement, and that you're using high quality data from multiple sources. So that's the point I really want to hit on, that I think when folks think about high quality data, it can also often be this focus on very quantitative and heavily statistical data. But I would argue that assessments that pull in data and information from multiple sources can be really, really strong in terms of creating a more clear understanding of not only what the health risks are, but importantly, why. What are the root causes of those health risks and threats? So I like to talk about community health assessment as a journey and not a destination. Sometimes in the pursuit of completing our community health assessment, we can walk through these, key stages of engaging, learning, and prioritizing, and then, mistakenly think that the plan for how we do improvement is sort of the end point or the end goal, when ultimately it really is a journey where once you have the plan and you move into action, you end up asking more questions such as, how are we doing now? Are things improving? And you find yourselves back at the stage of engaging so that you can repeat the process again. And that's why throughout my slides, I will talk about these different essential components in terms of sort of repeating through this cycle and in many cycles that feel more manageable and that are engaging community throughout. The models that I'm going to share 3 models. There are more, but these are the 3 that I've used most frequently when I've worked with tribes to do community health assessment. And I will be very honest and say I've only ever used each of these models in their entirety, maybe once. What I have found to be helpful about the models is to pick parts of them that are realistic and feasible according to what the tribal community says are their goals and what's manageable for them, and then to adapt and to bring in what's helpful and incorporate it into the process that they desire to use. So the first model is MAP. Someone in introductions already mentioned this. It's a really comprehensive and complete approach for doing community health improvement. They recently updated MAP to incorporate a greater focus on equity and also analyzing power and power relationships. NACCHO is the creator of this approach, and they provide a great training and really good resources on their website, including a virtual community of practice that you can join online and have access to other folks that are using MAP. I will say the model it's like a Cadillac, so it can be a bit resource intensive and time intensive, but there is a lot that you can learn about the nitty gritty details of planning a community health assessment and community health improvement process by reading through the user's handbook. But you may find you often need to make adjustments so it's more relevant and accessible to your community members. What I'm going to share with you are some of the tools and resources from phase 2, which is Tell Your Community Story. They've sort of revisioned what this phase of MAP looks like in the new 2.0. And they have incorporated 3 assessment tools in that phase. And I would say that typically phase 2 is what you would hone in on as the actual community health assessment piece of this health improvement model. The second model that I like to use or refer to was created by the American Hospital Association. It's the Community Health Improvement Model. There is a community health assessment toolkit you can find online that also is really a well-developed resource. I think what's helpful about this model is that it was created from a health provider, healthcare focused organization. So that perspective of healthcare and population health can often be helpful if a tribal health agency that has healthcare delivery and public health sort of under one umbrella leading the community health assessment. Their model has 9 very detailed steps, which can feel a little bit daunting to get started. But if you focus on taking one step at a time, it can really walk you through a comprehensive approach. I would say that steps 2 through 6 of their model is what most organizations would think or recognize as the steps in a typical community health assessment. And some of the follow-up steps are leading you more into the community health improvement planning process. Their reference materials are very clear and detailed. Their website has great resources. And I would say just some very concrete and practical suggestions of what to think about for each step. And then the third model that I like to share is actually an older example, but I find it really helpful because it's very straightforward and it's also grounded in tribal community health. So the Tribal Community Health Assessment for Public Health Accreditation, this particular toolkit created by the Intertribal Council of Arizona, Tribal Epicenter, was a pilot version from 2013, but I still refer to it quite often because it does lay out some common elements of a community health assessment process in very straightforward terms, and the content is still very helpful and relevant. The model has 8 common elements. They provide 14 sample tools that you can use in each of these elements or phases. They have good suggestions from a tribal community perspective, such as data sources that tend to be more common that are accessible in Indian country, and then also how to work with your tribal epicenter. So this is, although we have these really neat and simple visual diagrams that show us this like neat little circle that you can go through in community health assessment, I tend to think of the journey of community health assessment more as a long and winding road that has all of these like moments of growth and insights that we have throughout the process. And so we may start an engagement and go through a process of learning, prioritizing, planning, and we find ourselves in a phase of reflection and renewal. And then what do you know, we're right back at engaging. So this is the way that I like to sometimes present the full community health improvement process. And today I want to really focus in on the 4 essential elements that happen between learn and prioritize. And the way I think about these essentials and the way I would describe them to community or people just getting started are community wisdom and vision, the community context and culture, community needs and risks, and community sports and barriers. So how we collect these kinds of data are we connect, we listen, we gain new insights, and we analyze. So this is what I would consider the 4 sort of main types of data and information that we seek to gather and organize and make sense of with our community members. For each of these, I'm going to go through some of the overarching questions and things we might seek to learn, and then provide some examples of how we might do that. So for community wisdom and vision, these are 4 big questions we might seek to answer together. First, who is our community and who are our knowledge keepers, leaders, champions, and change makers for health and well-being? What's our shared vision for future health and well-being of our tribe? What goals and values do we want to honor throughout our process? And who is committed to bringing our wisdom, vision, and values to our collective efforts to improve health? So breaking this down, how do we seek to learn these things? Through connection. And very simply put, we want to try to brainstorm who in the community needs to come to the table, build relationships with those key people or partners, together discuss vision for future, and then come to consensus on these ideas. So on these definitions of community, on goals and values for the process. Some sample tools or resources with these 3 models that I have found to be helpful in the past as a starting point, and then adapting them for work in tribal communities are in this chart. So MAPS User Handbook has a few different stakeholder assessment tools and visioning tools and guides that are useful in this component. The Association for Community Health Improvement has a toolkit also, and their second step, Building Relationships, has really good suggestions and tips. And in the Tribal Community Health Assessment Model, there are 5 tools the Intertribal Council of Arizona has provided in the appendices that can be really straightforward, easy to use for helping you work through this component. The second major or essential element that I think is important for collecting data and understanding community health is community context and culture. And so the broad questions we seek to answer, or what we seek to learn for this essential component, is about those social forces and factors impacting health and well-being in the community. So aspects of policy, systems, and environment that influence the way people live, eat, play, learn, and pray. And asking the question, how does our tribe's unique history, geography, and culture impact our health today? And how do we seek to learn? Through listening. So if I had to describe a very complicated process in a very simple 4-step way, I would say to develop a short set of questions. When we say short, I always recommend 3 to 4 or 3 to 5 anytime we're talking about asking questions or developing a set of goals or priorities. It's just a manageable number. So develop your questions, identify key community groups that you're going to ask these questions, host listening sessions at various times, locations, and audiences, and then summarize your themes, create visuals, and stories. So when I say listening sessions, these could be anywhere from a one-on-one conversation to small group conversations to virtual or digital types of listening. It's not necessarily like an actual community meeting or gathering. From the 3 models that I've shared, some of the sample tools that I think are really helpful in this our essential element is from the user handbook for MAP. They have a community context assessment. It can be, like all of the MAP resources, very intensive and very detailed. But if you are at a stage of readiness and capacity where that's manageable for your organization, it really does get you a very thorough assessment in this aspect of your community health assessment. The ACHI model in their toolkit, step 3, they talk about suggestions for developing a community health profile. There are things in their suggestions that are really useful. And then they also have step 4, which is about increasing equity with data, which I think gets into some of the aspects of this context and culture that are important to us. From ITC of Arizona's model, they have a tool called Strengths, Weaknesses, Opportunities, and Threats Analysis Worksheet, which I think is a useful way to think about what kinds of questions, a short set of questions you might want to ask community members in community conversations. My suggestions for engaging community through this aspect of community health assessment is to meet people where they are. So in like physically in location, in time and space, but especially in terms of their readiness to talk about health and well-being. So making sure we're using language and concepts that are relatable for different audiences that we want to hear from and listen to. I think it's particularly important with youth nowadays because I have a 13-year-old and a 17-year-old, and I think that I know what's going on and I think that I'm cool, but I'm not always really sure, what it is that they understand and what they're ready to talk about. And so meeting where they are, thinking about how the best way to reach a particular audience is really important. I highly recommend intergenerational activities, like bringing people together for storytelling, talking about what's the biggest influence on their well-being. Youth digital photo voice projects are really interesting for this element. So having youth take pictures of things that influence their health and well-being. So providing them a short set of questions and asking them to go around their community and take pictures of things that answer those questions. I recommend asking simple questions, really straightforward to the point, and keeping them consistent. It does not have to be fancy and complicated. A question as simple as, what are some things about our community that influence you to make healthier and healthy choices, can help you get at some of these culture and contextual issues. And then in every phase, I recommend ensuring leaders are participating. Not only does it increase their buy-in and sustainability of the whole process, but also important for community members to see them out there and engaged in lending importance to the process. So sometimes this component, the way I think about it, this component of the community health assessment process, as I envision it, can be sort of deprioritized because people may think that it's not the statistical or numbers data, the quantitative data that's measuring risk, that's producing population estimates. And so, there's kind of a worry about how do we make this data, become more clear or more important or measurable. And I would just argue that, there are ways to do that, even with very short and simple and straightforward surveys. I like to have folks do community intercept surveys. So again, going to where they, find people in the community, whether it's a community event, gathering, school, youth group, and just doing very short, like pulse or intercept surveys where you ask 4 quick questions. And then you can do some really basic visuals to describe what it is that you heard from that particular set of questions. And if you mix up a few short questions and go to a few different locations, you'd be surprised with the kind of data that you can get and what you can learn. So the third element I would say is community needs and risks. And this is more the section of the community health assessment process as I envision it that I think we tend to really focus in on as being the priority for health assessment. The 4 broad questions for this component are about measurement. So in what ways can we measure our health risks and needs? What health conditions and issues do data suggest present the greatest risks to the tribal community's health and well-being? What social factors do data suggest we need to change? And how does our community's health compare to other communities?
Mhm.
The ways or how we might seek to learn these things is through gaining new insights. So breaking it down into 4 simple steps, I would say you focus on measuring needs and risks with numbers and statistics. So start from selecting indicators for each area of need and risk, and then find and compile your BAD. I love telling people to use their BAD. It's their best available data. Again, start where you're at. Every bit of data can be used for something and gaining new insights. And then where you find gaps in your data or where it just causes you to ask more questions, that's where you focus in on collecting new data to fill those gaps and create new insights. There are a lot of different lists of health indicators that are out there. And your list can be completely exhausting or it can be really focused and narrow depending on what you feel like is realistic and feasible for your community health assessment. I'm going to share 2 that I think have been helpful. So the Robert Wood Johnson funded a project called County Health Rankings and Roadmaps, and they created this visual. It's interactive on the website, and it shows the relationship between policies and programs, health factors and health outcomes. And then if you go to the right side of the visual, it gives you a set of health indicators for each of these different types or areas that influence health. So indicators for your physical environment, your social and economic factors, clinical care, and health behaviors. And it gives you recommendations or suggestions of what types of data you might find in each of these areas. And although they might not be, all those sources might not be data that are available at your particular like tribal jurisdictional service area or completely aligned with how you define your community, they may be the best available data that you have and a place that you can start from to start planning for how you might collect your own data with your tribal members specifically. The other set of health indicators that I like to refer to is from the Intertribal Council of Arizona's Community Health Assessment Toolkit. I think they keep it very straightforward and also more realistic for what tribal health agencies of all different sizes and capacity might have access to, and break it down into some to basic 7 or 8 categories of what you might look at. And then for other potential data sources or just things that I have found in working with tribes tend to be more commonly available or good data resources to look at to see what's there, I would say this is the recommended BAD. So first, your tribal epicenter. Sometimes state vital records are accessible by location, like some kind of geographic area, and also by race ethnicity. Some states do a better job of collecting their behavior risk factor survey data so that they have a large enough sample to be able to share results with you by American Indian Alaska Native within smaller geographic areas than just the whole state, particularly if you ask them to combine multiple years. Some states have a fairly good cancer registry that they can provide data numbers from. And then, of course, your tribal health services, EHR, or electronic health records, a diabetes program audit, your tribal police and courts, maternal child health programs, environmental programs, tribal education, early childhood. So I think we're probably all familiar with like a basic community health, conducting your own primary data collection for a community health survey and what that process looks like. I think that sometimes, again, it becomes like a process with an end goal where you are, conducting the survey on paper or online, creating that database, cleaning and doing your analysis, and then you create that visual and report. But when I think of a community health survey, I think of it almost entirely as a process in and of itself, where you are, once you have your visuals in your report, that you move into that next phase, which is hosting gatherings and having input sessions or sense-making sessions to help engage community members and different community groups in interpreting what the community or what the data mean. What do these results mean? How does this fit with your experience in the community? What do you think is missing? What questions does this raise? These are all things that we can ask and explore together through conversation that I think brings a lot of meaning and depth to our quantitative data, like a community health survey. So in our work with Sault Ste. Marie Tribe, we have partnered with them to help them complete their Sioux Tribe Health Survey. About every 3 to 5 years is what's written into their strategic plan. So the first time that we did this process was in 2012, 2013. We updated, revised it, redeveloped it, and repeated it again in 2016, 17. And then we just completed the 3rd cycle of this survey and the end of 2022 and beginning of 2023. And what that looks like is we form a community health leadership team, which has folks from all across the community, different departments and programs, and collaboratively developed the survey instrument, and then presented and requested permission from the board of directors to conduct the survey. We're granted permission to use the tribal enrollment list to do that. We submitted all of the materials and protocol to MPHI's institutional review board to get approval. And then in terms of selecting or doing sampling for the survey, and the first 2 times we did the survey, we used the full tribal enrollment list, deduplicated, so got down to just the tribal households that were within their 7-county service area, and did a random selection of households. And then we mailed booklets to the household with postage paid return envelopes. And then we mailed out 2 reminders. This most recent time that we conducted this survey, We had much less resources to do it, and also post-COVID knew that people were more familiar and comfortable with doing things online. So we actually used a method called mail push to web in 2022-23, where we sent, instead of a full mailed booklet, we sent an invitation letter to every tribal household in the 7-county service area with a link and a special ID code for them to enter the survey and complete it for their household. And then we did send 2 reminder letters. Our survey was open for 6 weeks in 2022-23. In previous years, it had been open for more like 12 or 15 weeks because of the timing of mailing. And so we did find this method, at least for Sioux Tribe and where they're at and the resources they have, to be more manageable and still effective. Each time we did the survey, respondents were offered the opportunity to enter a drawing to win one of 5 gift cards for $100. And we found between 1,100 and 1,650 surveys completed each time that we've done this survey. So quick recommendations around engaging communities in this essential element of community health assessment is to host those sense-making sessions. I like to use a short set of discussion questions as we show like a section of data and results. Just ask people what stands out to you, what part of the story is missing, how does this fit with what you see, hear, and know about our community, so that they're engaged in interpreting the data. I also like to do some kind of root cause analysis where you're asking, if these data that we see are sort of the symptoms or what happens because of other things, what are our root causes? So using a 5 whys approach in conversation, or doing some kind of root tree analysis activity with them, I find really helpful. And then sometimes we do intercept activities like dot voting, where we will share sets of data with groups and then ask them to, from their perspective, to pick 3 or pick 4 topics that they believe are priorities for them and for their community. And that might look something like this, just on poster paper or on a large sticky wall or something, where people can use their Post-it notes to indicate what issues and what community factors they think the data are suggesting are the top priorities. So the last essential element I would describe, in my words, I would say, is looking at community supports and barriers. And the overarching questions for this essential element are, what service systems and programs does our community currently have to protect and promote health and well-being? How well do our service systems and programs meet our community's needs? What gaps or barriers exist in our systems to protect and promote health? And how well do organizations and our service systems work together to meet the needs of community members? So a real simplified way of thinking through this component of the assessment, or what we seek to learn, how we seek to learn, is together with partners, brainstorm a list of your community programs and services, and then identify the key leaders in each of those programs and services. And then through an interactive process, document who in your community is being served and what's being done to protect and promote their health. And then summarize and share the findings back with community members so they can give feedback on how that fits with their experience and awareness and understanding of what services and programs are available to protect and promote their health. We did a process like this when we conducted the Spirit of Community Health study. Wow, back in 2014, it didn't feel like that long ago. Time really flies. And so what we did is we collaboratively developed with a tribal advisory group this, for lack of a better word, an interview protocol. So there is a local public health system assessment tool that some health departments use to do a comprehensive analysis of their public health systems. When we were trying to use that tool with tribal public health agencies, we found it to be lots of parts of it to be not relevant or to be too far advanced for where the tribal public health system was. And so we really, streamlined it to, how do we hone in on or study the essential public health services in tribal communities? What do we need to adapt or modify to make it more relevant in this particular context? and with the resources and capacity that are there. And so we developed a set of interview questions in order to learn who and what services were protecting and promoting health. So it really is an adapted and simplified public health system assessment. And as part of that assessment, in doing an interview one-on-one with, let's say, the emergency preparedness manager in a tribe, we sit with them and individually create an eco map of their network of organizational partnerships. And then we use, in our case, we used like a computer program to create one large network map of the tribe's organizational network and partners that were all providing programs and services to the tribal community to protect and promote health. If you're interested in that protocol, it is available online on our website for free, or you can email me and I'm happy to share it with you. And that is my contact information. I feel like I just talked really fast. And I will end my slideshow so I can see your faces. Are there any questions, observations, comments?
Yeah, and feel free to unmute if you have any questions or comments. You can also use the chat box as well.
Hi, Shannon, this is Sai. Thank you for that wonderful presentation. Can we just invite you to our work group? No, I'm just kidding. A lot of what you talked about in your presentation, we have kind of done those processes already. So essentially we're on our start, but I'd like to, maybe perhaps get in contact with you to kind of pick your brain about some of the processes we're already engaged in and how we could use that better to our advantage. Just what we were grappling right now is defining what community is for our region. You may or may not know this, but we have well over 100 communities across our tribal jurisdiction. So there's so many levels that a chalk could be done on that. We could do one that's comprehensive, that involves what would look like, what community would look like, and assessing, quote, community, unquote, across all the 110 communities? Or do we just do 110 surveys and do 110 CHAs, which is a lot more work for us to do? So you kind of get the idea.
Yes.
Why we're engaging in this discussion. So.
Mm-hmm. Yeah, this is the challenge, right? Of being a sovereign nation and recognizing that often you may get compared to more like a local community, and you're like, oh no, we're more like a nation, because we are a nation, and it's actually much more complex and multi-level than that. So yeah, these are the kinds of challenges that I really love doing thought partnership with, and just trying to come up with some creative ways, or importantly, some resource reasonable resource ways of doing this, because doing 100 surveys and assessments feels really unmanageable when you also are working in a public health agency that probably has you filling many roles. So I would love it. I'd love to talk through that with you.
Thank you.
Thank you.
And then we invite you guys back to tell us how you did it so we can help everyone.
I do remember, I mean, I've been around long enough that I do remember, I think when Navajo Nation was starting the initial round of assessments, and running into folks at conferences way back when, and it's an ongoing challenge of trying to make sure that you're tailoring, and really, I think it's also complicated by the sense of wanting to get it right. And so I think that's the other thing I encourage people a lot to say, there really isn't a right way. It's start with what you can do, the best that you can do now, and make note of the things that you'd like to improve and do better next time, because we can get stuck sometimes in trying to make things be the have all be all everything the first time or the second time or the third time.
Okay. Awesome insight. Okay, any additional questions or comments? Okay. Not seeing anything in the chat box. No unmuted line.
Hi, this is Feline from Navajo Nation. I thoroughly enjoyed that presentation. It is a lot of information in just a few minutes, and will we be able to get a copy of that? And Shannon, if we may contact you, I really would like to do that, and I'd like to review your presentation. And I'm so encouraged by the 3 types of MAP assessment, or the assessments that you gave us besides MAP. And it's nice to see or to become acquainted that the Arizona Indian Tribal Council Center has one. So that's new to me. And the other one, the middle one, is new as well. So I gained a lot from your session. Thank you.
Oh, I'm so happy to hear that. I was really stressed and trying to think about what to share in like about a half hour. So I'm so glad that you took something away from it. And yes, very happy to talk with you. I have contact information in the chat. You can pop it in there. I'm sure Jessica can also follow up with me if you can get it to Jessica, or through my email address that is in the last slide. And yes, I'm happy to share the slides with everyone.
Thanks so much.
Yeah, absolutely.
Okay. Anyone else?
Well, just one last comment. I really like to ask the 5 whys. Those were really good questions. And as you were going through them, I thought, would that just be enough instead of using the 3 types of the models that you presented? Or are these in addition to the modules? Thank you.
Yeah, absolutely. I love simplifying things because I really do. I trust the group process. I feel like when you get in groups and have good conversations, things come up unplanned, and you can, yeah, sometimes it is the simpler the better. So I really appreciate that.
Another question for you, Shannon.
Yes.
Have you come across, or are you familiar of any tribal nations that have their own well, I avoid using the word standard, but if they have developed their own social determinants of health?
Oh, I haven't. That is a great question. That feels like a really good collaborative project to do. I so maybe the closest, they're not calling it social determinants of health, but I am aware that Chickasaw Nation, with their a couple of their upcoming grants, they're working with a university and they're developing indigenous measures. And I think that it's not comprehensive in terms of how we would think about social determinants of health, but I think the process they're using to develop indigenous measures, in this case, it's related to ACEs, but I think would be a really cool way to think about developing a set of indigenous social determinants of health. Yeah, that's something I'd like to explore, and maybe put the question out through NIHB or through networks to see if anyone has come up with their own set.
Maybe
Yeah,
it
we've
should be under the
been working
terms
with
of
oh, I'm sorry. Go ahead.
yeah, I'm sorry, I didn't mean to cut you off on Jessica. Maybe it just needs to be retermed as cultural determinants of health for tribal nations.
Well, and it looks like in the chat, Helen gifted us with some information from Seven Directions, the Indigenous Public Health Institute. Thank you.
Yeah, and we're actually working with the World Health Assembly to develop the indigenous determinants of health. So they're actually coming up with a global action plan for 2026 to get those implemented. Our CEO, she's been traveling internationally. If you're familiar with like Dr. Warren, it's a large group of individuals that are actually putting those in place. So if you want a session on indigenous determinants of health, maybe that's something we could get going for our next talk. Let me know.
Awesome. That would be good. Really good. Thank you.
Okay, anyone else have any final comments or anything as we conclude for the afternoon?
Thank you, Jessica, for bringing this to our session for today. Actually, these are exactly the things I've been thinking about before I rejoined again. This is like my first session, and I'm so glad this helped my brain power to remember a lot of things. So thanks so much, Shannon and Jessica.
You're very welcome.
Okay, so on that note, Shannon, I want to express my extreme gratitude for you joining us this afternoon. Seems like we have a lot of work that we could get accomplished together. So we're looking for a couple of emails from me on just some thank yous and seeing how we can improve our networks and work together. So thank you, thank you, thank you. It looks like we have many thanks in the comment box as well. So I'm going to circle back with you after the call today, and we'll be sure to get that presentation material and Shannon's contact information. I'll also include the links for the indigenous determinants of health with everyone that are in the comment box, so we can see if that's something that we can build out for our next talk or a future talk. Okay, so it's 4:01, so I'll let everyone go for the afternoon. Thank you so much for joining us. We'll see you next time.
Thank you. Thanks for having me. Take care, everyone.
You too.
Take care, everyone. Bye-bye.
Bye.
Bye.